The Overdose Response Team was created to address a prevalent community need in Tulsa, and that's overdoses. We've seen opiates causing a lot of havoc within our community, not just in Tulsa or Oklahoma, but really nationally. Public safety, whether it's fire and police, are responding to right around 8 to 10 overdose calls a day. We created a specialized team that has a community paramedic along with a peer recovery support specialist or someone with lived experience to respond to real-time overdose calls and provide follow-up to individuals who have overdosed within our community. So the lived experience individual, that's someone who has used some sort of substance in the past and recovered.
I've always had a passion for addiction recovery, things like that, because I'm in recovery myself from drugs and alcohol. So when the opportunity came up, I snagged it up. I was very excited to be a part of it, and I still am. I love it. It's probably my favorite day out of the week because it's a chance for me to give back to the community that I came from. I've been in recovery for 5 years from drugs, and I haven't drank in like 10 years. I came from a pretty tough background, lots of trauma growing up, got in trouble a lot as a kid, been homeless, I've been part of domestic violence, and everything from alcohol to prescription opiates to methamphetamine. So when I first got clean, I decided I wanted to be a part of the movement for recovery. And I got into working at a drug and alcohol treatment center for several years, and I really loved it. And
what that gives us is the ability for someone to really connect on a personal level and say, hey, I've been in a similar situation before, but I've recovered. So the Overdose Response Team is meant to complement the current infrastructure we have in place that will go identify individuals who have overdosed, build rapport, connect to services, and stay with them until they've gotten the help they need.
Are you on a housing list?
Yeah.
Yeah? Good. How long you been on it? With the interactions that we've made, we're slowly building relationships with people through outreach. I think there's a trust there that some programs don't get. Thank you.
This is a model that has worked in other cities. We went and looked in specifically San Antonio. Oklahoma City implemented this program in August 2023 to address these needs. And what these previous communities have found is they're able to get people help earlier in the substance addiction than they were previously. We do emphasize the harm reduction supplies and the hands-on CPR and some of that education because we're very passionate about giving someone another chance to get it right. And so the harm reduction boxes complement our overdose response team. We've put those boxes in areas of our community where we see the most overdoses. And so we have these at a couple fire stations, easy access to Narcan, leave behind kits, as well as fentanyl test strips and education pamphlets. We want to prevent someone from losing their life.
I think in some areas we've seen a significant drop in overdoses, and our hope is that we're playing a role in that by giving out Narcan and test strips and things that people might need so they have a chance to stay alive. You don't gain recovery by force. You've got to want it for it to be successful. So we're just there to help guide that situation and keep people safe for as long as we can. I think another part of it is people seeing us out and about all the time in these areas. They know that if they wave us down, we'll stop. We'll give them whatever it is that they need, even if it's just somebody to listen to them.
And so I think that can build a bridge with certain members in our community to sit there and say, hey, you know, we're just here to lend a helping hand.
It helps to humanize the situation, I think. You got this? All right.
And that's something we're very passionate about, is continuing to move that ball forward with these individuals and making sure they know this is the things available to help you. And we can help walk alongside you during that process.
But we'll also do follow-ups with them, with their family, see if we can connect them to resources or get them to treatment or get them harm reduction supplies. Whatever it is that they need is what we're there to do. And whenever anybody's asked us for help, we've been there and we'll help them.
I would say we're continuing to address this issue within our community and really make sure we're providing resources, whether that's response, somewhere to go. We want to make sure that we have the best system in America here in Tulsa.